can begin.
Good morning, I'm Mrs. Handy and I'm one of the patient care instructors for South Texas College. We have the patient care program, which consists of 4 certificates that you're able to get in a short semester. We take care of long-term care patients in a nursing home, and we also go to take care of patients at the hospital, which is acute care. The requirement is 16 credit hours for the college, and it is a full week. We have 2 schedules, 4 days a week or 5 days a week. So you can have clinical Monday, Wednesday, Friday. They're shorter, or longer clinicals on Tuesday and Thursday. Classes are Monday and Wednesday, or opposite, Tuesday and Thursday. 4 certificates. 1 is a state for your nurse aid certificate, and 3 for national certifications. Phlebotomy, you can be a phlebotomy technician, EKG technician, or patient care technician. With those certificates, you can work anywhere it is that you would like to work. To get into the program, we have requirements, which is a background check. We have you have to have certain vaccinations. You can go through Cynthia Curtis for registration, or Angie Reyes to get any information regarding the background check and the vaccine requirements. We have a standard uniform. The students wear a purple top with white bottom. Always with a clinical ID badge, so that when we go to the facilities, we're able to recognize the patient care students. Attendance is mandatory. 10% of you're allowed to miss. That would depend on which class you have. If you have a longer class, then you may be able to be absent 2 days. If you have the shorter class, it may be 1. But the requirement is you can only miss 10% regarding the program. We have students. Our students can work in all the different facilities. They often get offered many different jobs in different areas. EKG technician. Whenever we take them to the hospital, almost always our students come out with job offers. They always ask them to work in the emergency room for patient care technician. McAllen Heart Hospital will often offer them jobs. DHR has often offered them jobs. They tell them, as soon as you're done, please come and work with us. We have all these opportunities, and they can work anywhere. They can work at a doctor's office, they can work at a facility, a nursing home, dialysis centers. They can work at all these different types of facilities. The wages, the pay for CNA averages between, I guess, $9 and maybe $11. Patient care may be $9 to $12. We have had some students that have reported $15 for EKG technician, up to $15, depending on the experience. What makes our program so great is that you get to do a lot of things in one semester. You have many requirements, which makes you very marketable. When you become a nurse and you move on to other programs, you get points for taking this program. ADN will offer points, LVN will offer points. But whenever you become a nurse, a lot of the students that have graduated from our program place their LVN license or their ADN license, their nursing licenses, and then they have 4 certificates, which allows them to do many different things. They can draw labs as a nurse, of course, because they've already been trained through us. They can run EKGs, and they can assist in all kinds of different settings. So our program is very, very beneficial to any nursing student. If you decide you don't want nursing, it also shows you all the different areas of the hospital so that you can decide where it is that you would want to go. A lot of students leave our program and decide, I want to do radiology or respiratory therapy or other different programs. But this is a program that will show you all the different areas. Any questions?
Yes, Miss Andy, I have several questions coming from your presentation. I was just wondering, first of all, what your credentials are and where you got your education.
Well, I'm a registered nurse, and I got my education here at South Texas College through the ADN program.
So when you speak to what the students will take out of this program into the ADN program, you have firsthand knowledge of
Yes.
what's required and what's needed?
Yes.
Great, great. When you talk about the hospital rotation that the students will do, what kind of units are they working on, and what kinds of things are they going to actually see?
Well, they get to go to all the different areas. We go to the emergency room, we go to surgery, labor and delivery, we work in the lab, we work at all the units. We've gone through dialysis, we go through let's see, all the telemetry floors. They get to spend time with the monitor technician for the hospital. And where else?
Sounds like there are lots of
They
experiences
have
that
a lot
they're
of
gonna have.
they get to go to all the different units of the hospital.
To get into the program, are there any testing requirements? Do students have to have
No,
testing scores or anything?
no, we don't have any requirements. They could just go in and inquire with Miss Cynthia Curtis or Angie Reyes, and then they will direct them.
And so it's kind of first come, first serve until the
Yes.
classes are full then? Okay.
It's a first come, first serve.
Yeah. You talked about the number of hours that are required, and one of my questions is just, what about the reading? Is there a lot of reading that students have to do?
Yes, they have a lot of reading to do. The students are required to have read their material before they come to class, and they're quizzed before we even start the class.
Yeah.
So each instructor works it the same way. They come in on Monday and they get a quiz right away, and then we move from there.
I've actually heard that on the very first day of school, students have a quiz.
Yes, that is correct. Thank you, Mr. Williams.
About the clinical days, you talked about the two different ones. How long are those days, and when do students have to be at the hospital?
At 6:30 in the morning. Sometimes we have to go at 6, depending on if we need certain skills like showers, we'll have to go at 6. Our clinical is from 6:30 in the morning to 1:50. For the first 6 weeks, we have the longer clinical. The second clinical is from, the second half is 6:30 to 5:20.
Okay. So
Those are long
longer
days, yes, but they do get breaks and they get to eat lunch.
On the certifications, do the students have to take all 4 of those? And
Yes, it's part of the program requirement. They will have to take in order for them to continue with us in the program, they have to complete the CNA course. If they complete the CNA course and get their CNA, then we can move on to the second part, which is patient care. Once they're done with the national exams, that goes in as part of their grade to complete the program.
okay, super. The criminal background check is something that is probably new to a lot of students. For the
Yes.
patient care program, are there any things that would keep a student out of the program? Or what my question really is if I have something on my criminal background, is it going to keep me out of the program?
Well, I'm not sure exactly what they're looking for.
We should check with
With
Ms. Curtis. and
Mrs.
she
Curtis
could-
will
Mrs. Curtis
let
should
us
be
know.
able to help
I
us.
know that they have different ones, but there are, I think anything that is, Mrs. Rice has always said, if they handcuffed you for it and took you to
Uh-huh.
the police station, we would have to clear that up.
Yeah, okay. And Mrs. Rice is
The program chair.
Great. So with respect to the vaccinations and the background check, you all will take another class in January. If a student's interested, when should they start working on that?
Probably now,
Right
because
away.
they do need to take a certain amount of vaccines within a certain amount of time.
Okay. And with the uniforms,
Yes.
what about things like makeup and perfume or cologne, those kinds of things? Are
It's
there-
minimal makeup, very minimal makeup, no perfume. We're really happy with soap and water when they take a shower. And a white underwear,
Yeah.
because the
White underwear.
pants are white.
No
yes.
smiley faces.
No.
Okay. And what about jewelry?
Very minimal jewelry.
Can you describe why would it be that a student in a clinical shouldn't be wearing a chain or long earrings?
Safety issues, those are safety issues for the student and for the resident. A lot of times the resident will just see something shiny and grab onto them, and the student will end up getting hurt. Or if we wear anything too bulky, we can often tear their skin, so we have to be real careful with how we care for them.
And patient always comes first.
Yeah, and the patient.
What about if a student is late for a class, if they don't have their student ID with them, what are the consequences of that?
Well, we do have consequences for being tardy. They'll have to wait outside until we get the class settled, until they're allowed to come back in. If they don't have a badge, they're not allowed to be in the building, so they cannot stay in the classroom. They'll be asked to go get it or leave the classroom.
Okay. That's great. I think that's all the questions that I have for you now. Is there anything else you wanted to add to the presentation?
Well, yes, I would like to tell your students that a patient care program is a very, very good program regarding the fundamentals of nursing, and from here you can just build your career and move forward in anything you decide you want to do.
Great, thank you very much.